Dr. Chris is live in the studio. Which one comes with the six childhood killer diseases? Yes, we got it right. Last week was tuberculosis. We move on on another one today. Doc, good morning and welcome.
Thanks for having me.
How was the injections yesterday?
Everything was fine.
Yeah, you look at human being and then you take pin and choke the person. Talk about wickedness. That's wickedness.
Imagine we are paid for it.
And you are paid to heal.
You say thank you and then you appreciate the pain and then you go.
Doc, before we talk about the today's topic, let me just ask you this off grade. When you cut open a human being, look inside, Doc, how? Two questions. What runs through your mind? What do you see?
Solve the problem and get out. Because it's not a time to smile, but you tend to appreciate the complexity of the human body, and you understand that internally everybody is the same. So
a human being can live with a stomach cut open
for how long? You can survive
for as long as, or do you have a time duration?
There's a duration because it's a sterile area. So as soon as germs and bacteria, I think, infiltrate the area, then the time is limited. That's why we do it within a time frame. We get in there, you do as you do, and you close up and you leave. You don't mess around.
Doc, what's a human being inside the body like? Like,
I can't explain. You have to see it to appreciate it.
No, we see pictures and drawings.
Yeah.
But when you get there, is it nasty?
Some are.
Inside are nasty. Look, if you look at us in the studio, who do you think have a nasty inside?
How can you just look at somebody's face?
Maybe just inside is nasty. You see him, fresh boy. Maybe you actually open his inside because they say beauty,
life is skin deep.
Yes, in the eyes of the beholder, but you say inside out. Yeah, beautiful inside out. Maybe the inside. No.
What? You're beautiful. You're beautiful on the inside.
Yeah, beautiful on the inside.
We'll just say that to fat people.
Can hear the laughter in
but it's true. Society is not honest.
Hey, serial.
When we know the person is not nice, then we start giving those idioms. Bossu, let's do this.
No,
but am I lying? Or it's too early?
It's fine. You're on your own.
I didn't say I'm with you.
Okay.
Doc.
He doesn't want to be part of it.
Jesse, don't you see beautiful?
Nobody wants to be part of that.
Is when you see Ayasta or Tyler
trending live,
do you tell them that the beauty is on the inside? You can't tell that the beauty is there. They brought it. It's only when you can't see it then you start looking for it. So it might be on the inside.
Today on Being Real,
the TikTok people, they should cut my good side though.
I mean, viewers, we are coming to our dragon diseases. We're going to talk about the six killer childhood diseases. We're going to talk about
six childhood. The things happen in childhood, bro. They are not six children killing anybody.
Six childhood killer diseases.
It makes it sound like a horror film, like six children are going around.
Yeah, Doc, I get it.
It's 6 CKD and you move on.
Yeah. You're 6 CKD.
Yeah.
I say tape brand. But we'll come to it. And that's our cover this morning, which we'll gladly have. And we're talking we're talking measles, I suppose.
Right.
Yes, we're talking measles. We'll talk about that. But I'm just intrigued about if inside the human body, it's as we see on in the pictures and the diagrams as displayed, or it is hard to identify maybe kidney and liver.
Oh, yes, in certain situations it's hard to, especially if the person has had previous surgery before. You know how spaghetti behaves. When you boil spaghetti and you don't put oil around it, it tends to stick together. Now, God in his wisdom, when he created the abdomen, the organs, they are all in stasis. Nothing is holding them. They are just muscle structure and strands holding them together, ligaments holding them together. So that whole area is sterile. It's very sterile. So your stomach is separate on its own. The kidney is separate on its own. Everybody is in their own space.
So basically, they are held firmly together by each other.
Yes, by just small strands of ligaments.
Also away from each other.
Away from each other. So it's basically just air space that fills that area. If you expose that area to atmospheric oxygen or air, adhesions start to form. They start to stick to each other.
And they lose stasis.
And they lose that stasis. So you might go in when you open up, everything's in the right place in the first place. But when you expose it for too long, when you seal it up, you go in again for maybe another procedure, you might find organs sticking to each other.
Funny question, but when you perform such procedures and surgeries where you probably have to shift things, do you remember where the places are to put things, or the body naturally restores it?
No, we do, but as long as you've not broken the connection, like or the vessels that are attached to certain organs, it will keep working wherever it is. It finds itself.
Charlie, God, man. Shouts to God.
So you can put it anywhere.
Yeah, but just that you see, because it's a vessel that's connected to it, there's a length
like
to that, so you can't just stretch it to a certain point. Yeah,
Okay.
There are limits to how far you can move it around. That's why sometimes you have to have like somebody assisting you, holding certain things in place while you work. But when you do surgical procedures like laparoscopic surgeries, those ones you don't really open up. You put a camera through the umbilicus, then you put a scope through, a probe through, and then you just work. And now when we push carbon dioxide into the system, the abdomen, to inflate it, so you get space of view, you get spatial view to work. And now I'm going to carbon dioxide is opposite of oxygen, as free oxygen. It doesn't cause adhesions.
Is there any instance where you've
we're not changing topic, viewers. We'll come to it, but just wanted to.
Is there any instance where like you've opened up a person and like found the beauty on the inside?
Doc,
this is where we move on. What's wrong with you?
Just
want to cause trouble.
You are not telling Fatih
again, I want to ask this. When you perform procedures, are there which organs, the very common ones that we talk about, maybe liver, stomach, intestines, which ones when you cut, are you able to stitch back and safely have it function the way, or there are ones that you don't touch?
If you are not working in a certain area, you don't go close to those places. When we start from so you're just talking about the abdomen.
So let's say you cut
the abdomen. The first thing you are very careful about is nerves and blood vessels, because you don't want to cause bleeding, and also you don't want to close up, and the person will lose sensation in certain parts of their body. Those are the two things you are going for that you want to avoid.
But these nerves are all around in there.
Exactly. That's where anatomy comes in. You need to study where every nerve passes, and they have their pathways, so you avoid those pathways.
Oh, okay.
And even muscle structures, they are round muscles. Their muscles have circular muscles, and they have the way they are arranged. So some are going this way, some are going that way. So when you are making an incision, you make sure you don't cut across it. Right,
okay.
of course, according to a line, which they are. So if you look at the bikini line for CS, they do it such a way it's a circular motion. That way, it's in the same muscle structure. That when he heals very well.
Okay, that naturally.
Not like the before. You see, before this go that way, and then you see a big wound.
Wait, this is vertical, right?
Yeah, vertical.
And along, like in carpentry.
Interesting. I've always wondered. There's a lot to learn on,
Yeah. So before you the first thing you learn in medical school, any medical profession, is anatomy. Nurses do it. We all do it. And if you don't have that foundation, you don't grab that foundation. That's it. You can't touch somebody, because you might not even taking blood sample, might not know where the blood vessel is or what it's called.
Then on a very lighter note, we must learn this anatomy must be taught right from primary school.
The advanced countries teach it from primary school.
Trust me, you have no idea what I'm talking about. But let's get back to the conversation. Doc, this morning this is when we bring our daughter back to our world. He was going over, but I just had to bring him back. I have to learn anatomy.
Curious, is there
Doc, there's nothing he's going to ask you that is Doc. Okay, all right.
Treating me like this.
We are listening.
Is there like a medical criteria that qualifies like as beautiful?
You see?
As you can say healthy, you can say prone to disease, you can say all those things, because beauty is like the combination of features, right?
Yeah. So
if medically,
medically we can see certain things.
I'm asking because doctors are making people beautiful now. So
yeah, that's what I'm saying. That no, we are making them beautiful according to what they describe as beautiful.
But you as a doctor, is there a beautiful? A standard.
My standard for beauty is everything works well. You are fine and healthy. That's my beauty.
I love that. I love that, doctor. Thank you very
much.
My question being
yes.
Let's fry plantain, bro.
Let's fry plantain. Talking about that.
Today you want us to talk about vaccine-preventable diseases, VPDs, and then the ongoing threat of measles and strategies of eradication. Right. Now the question
is, I think so.
Preventable diseases.
Yes, there are diseases that it means that there are diseases that with the concept of vaccines now, those diseases we are preventing death. due to those.
Okay.
So there's a list.
So
of them.
advancements have led to the fact that we can avoid them. Basically.
Yes.
Okay.
So advancement had led to like because those times it was killing a lot of people.
Okay.
Measles was killing like 15 million people.
Crazy.
Yeah, like infectious disease.
It's
But please, wait, Doc. What
Yes,
is
exactly.
what is measles? What is
Because
measles?
example are way ahead of you.
Doc, what is measles?
So measles is caused by a virus. It's a
Okay.
viral infection. So it's an infectious disease and it's aerosolized, so it's respiratory in nature. And the weird thing about measles is that when somebody who has measles coughs into this room right now, it can be in the air for 2 hours.
Wow.
Hours.
Yeah, so he coughs and leaves, right?
You said being there, like literally floating.
Yeah, like they'll be around for 2
Crazy.
hours. And it can. So the more that keep coming, everybody gets infected and keep going and coming.
What?
So
Wow.
there's this story during the Olympics in half the year. Let's see if I have the year. If I have the year right. There was a Special Olympics some time ago in Minneapolis, St. Paul's Metropolitan during July 1991. So what is that? An athlete had measles and he coughed at the entrance. You know where the athletes go to the athletes' entrance, where they come out. He coughed over there, right?
1995.
Is it 91 or 95? I think it's 91.
91. Back
Yes.
in the 91.
Yeah, 91. I think-
Minneapolis, St.
yeah.
Paul's hosted the Special Olympics. Yeah.
Yeah. So when he coughed at the entrance, somebody who was sitting about roughly 30 meters away at the top, you know, the stadium, how stadiums are designed. 2 people were sitting up there, they got infected.
No, 30.
Yeah.
So literally floats around.
Yeah, it floats around for 2
If it's
hours.
not in a confined space.
Yeah, it's just be floating. I know how stadiums are designed. It's so like circular and everything is in there.
So that's why you have to get the vaccine to prevent.
Exactly.
Yeah,
so
yeah,
that's when we
yeah.
talk about things like herd immunity. Like herd, like cattle. You know, when you have a herd of sheep, the idea is that if we are 5 here, right? If 4 of us are vaccinated and somebody comes in, which is about 95% of our number, or let's say 4 of us are out of the 5 is vaccinated.
I get it.
Somebody comes with measles and infects, the only one person is susceptible. The other person who is not vaccinated is the only person who will get infected. The rest of us won't.
Yeah.
Is there any truth in they saying once you get measles at any point in your life, you can't get it ever again?
Yeah, so I was going to come to that. So there's different types of vaccination, right? So I wanted to explain what vaccination is. So vaccination, immunization, do you think they're the same thing?
Well,
No.
once there are 2 different words, they will not be the same thing. Just for
I
that
don't think
fact.
so.
You don't think so?
I think
so.
so.
You think? What do you think?
I think immunization is against contracting the thing, but vaccination introduces a bit of the thing into you.
You don't know. Let me show you. The act of getting
You are reading from the TV.
use
Is it
immunity to a
senses
specific
in the eyes
infection.
of the beholder?
Oh wow! Everything I said is on the screen. And immunization is becoming immune
Yeah,
to
that's what I
a
just
specific infection or disease, typically through vaccination. It's so coincidental that what I was going to say
So
is
you
exactly.
become immune after you vaccinate.
Exactly. So let's say vaccination is the method, and then immunization is the outcome of the method.
Right.
Oh, okay. That makes sense.
Vaccination is the method, and then immunization is the outcome of the method.
So if you want to use the sexual context, it means that sexual
Oh.
intercourse is the method, and
And
then
the
the
baby-
baby becomes the outcome, the immunization aspect of it. Right.
Right.
So now the reason why it's so is because in vaccination there are different types of vaccination. There's one where we actually introduce the live, let's say measles into your system,
Yeah.
and then your body learns to fight it, creates antibodies that learns and figures it will become memory, like muscle memory. Like, oh, we know this guy, we beat him before. Then they go ahead. So every time measles come, they just shut it down. And there's another one where we take a piece of the virus or the bacteria and introduce it,
Yeah,
and it creates the
I've
same
seen
thing.
the thing.
There's a third one where we actually kill the bacteria or virus. We kill it, like put it in stasis, it's dead, and we introduce it. So there are various types of
Imagine
vaccination
if
that's
this
done.
could be done with every
And
disease.
the other one too is the one where you actually, on a natural basis, as you said, you get the chicken pox or whatever it is, your body develops antibodies
Yeah.
against it and you fight it naturally, which happened with COVID.
Yeah.
So a
But
lot of
you
people got
mentioned
the
chickenpox. Has it got any relation to?
measles.
Yeah.
The symptoms are similar.
Hey,
So
Charlie.
people mistaking the two.
Yeah.
But both of them
Have you had
have
chickenpox
vaccines for
before?
them.
No, I've not. I've had
Jason,
measles, and
you
that
had-
was I got that from school. But when I was really little, but I remember it so much because they use milk
The
of
most-
magnesia.
Yeah.
You are white all over.
The
Oh.
most dreaded
And
illness
it
or
is at
whatever
night.
is what do you call them? It's what we just said. What's the name? Chicken pox. You get some before cereal.
Boof.
Charlie.
You've got both measles and chickenpox. Jay, how about you? You got chickenpox.
Hey,
Yeah, but it's a
and I
vaccination
just
under
want to
five.
take a few
Under
seconds
five.
to just tell you my experience. A few seconds. I promise not to care. Because I just came home one evening and I saw.
Were you an adult or like how
adults,
old?
adults,
You got adult chickenpox.
Oh, SS
Wow.
boy crowd. I've grown crowd. I've swept this all my years of
Yeah.
life. At SS3, we're writing SSC. Yeah,
Alright.
we're writing.
You didn't say what's you.
No, SSC. But when I hear that in Wasi, they sound like some French exam to me.
You wrote SSC.
SSC, yeah, SSC makes it like scare. Scare. Oh, I see some small dots view on my some small dots view. It's like some few minutes, I think they itch me. I catch up now. The next 1 hour, I see then my stomach another dot appear. Then the next thing you know, bro,
Break
for
out.
the
Heart
next
caught.
14 days.
14.
Hey.
2 weeks.
Yes, you know it takes
Wow.
about a week.
You're becoming a balloon.
See,
Sorry, yo.
you have to be naked with
Calamine
calamine lotion.
lotion. Yeah.
They paint you
AKA
by
And a standing
because
fan.
when you and it's because
AKA
when
calamina
when
lotion.
one part of your body touches the other part, it go H tire.
I'm
Hey,
not,
give
not
up.
contact too.
hey, you have to, and you know the part. Pardon me, viewers and listeners. The part that even is worse is around your groin.
Yeah.
Look.
your butt cheeks and all that.
It will
Yeah.
be like- it will be like just remove it.
Bruh.
You know, it will eat you to the point where I'm just looking at it like, and I mean,
But so is that how measles? Is that how measles also happens?
So the difference is that chickenpox didn't come with coughing and sneezing. Measles comes with that. So it comes with coughing and
So it's
sneezing.
worse.
do they both
So-
come with fever?
Yes. Yeah. So and the thing is that measles infects 18 people. One person can infect 18 people.
One person.
Yeah, one.
One socket to multiple users.
So you have high fever, you have your cough, you have your running nose, and you have red eyes. Red eyes is the main factor there. Red eyes gives you that, oh, this is measles. And then after 3 to 5 days, you have rashes everywhere. Your face starts from your face and then down to your whole body.
It is painful.
Yeah, no, it was crazy.
I can imagine. Tell us your story.
Oh, so this happened. I think I was under 5. Oh,
Yeah, it's always under 5.
yeah, I was under 5, and I remember it so much because it happened in nursery school, and then this guy came who had it, and I mean it's a class, so we're just all like, oh, see, the next day I didn't go to school.
Everybody will get.
It was just on my body.
Does that mean at that time you were not
Passing
vaccinated
was
yet?
I think I was, but I don't know what happened. My mom maybe has to explain that, but it was painful. It was
do you have to apply?
uncomfortable.
Yeah,
calamine.
that's
Yes,
because
and
that's
milk
the
of magnesia.
treatment. Milk of
That's why I
It
said-
won't be
magnesia.
bad for you to get it at this time, and then it'll be done for you.
I'll be home.
Because I was in the application here. At that point in time, I literally had to let go of my adulthood and allow myself to be
To be treated.
taken care of, yeah.
yeah.
because
yeah.
see, Charlie, you need help. You just notice
That's
that you
why
need
when
help.
you're an adult and you get it, it's worse.
Are there any stages to measles types? Or
No, it
just comes in.
It just comes in like that. But it starts from a point. As I said, it starts from you having the high fever and the cough, then the running nose. So it comes like a common cold. I have a fever. I have a common cold.
What is that? And I ask stages because is there an end stage? Like, is there a point
Death.
where it's death?
Yeah, it can affect your brain and get death.
Wait, what?
Measles, yeah. Severity of measles can kill a child.
And this is because maybe
Yeah.
treatment is not quick, is not efficient. What would that? Whoa.
Yeah, is it like
So
bad
between 2021, measles vaccination prevented over 56 million deaths globally.
Wow.
Just think about it. 2021, 56 million people would have died without the vaccination.
What's the stats right now in terms of
The
are there
stats-
still deaths?
The stats
from
right
measles,
now,
or
the
we
stats right now
fine?
are really good. Things are really good right now because
Okay.
we are having a lot of herd immunity because a lot of people are getting vaccinated. So out of
Okay.
the numbers, but we also have a problem right now. During COVID,
Mhm.
we stopped vaccination.
Why?
We were home,
Okay, so the kids.
so a lot of kids didn't get what the shots they needed to get.
Oh.
Oh.
So like we are talking about those that are crying like the global major cities, fine, but those who were outside, like the villages, and because the nurses were public health nurses move and go into those areas.
Wow.
But because of the COVID and no masks and everything, the fear factor and everything, so we had a gap in there. So we are trying right now. They are trying to mop up.
Okay.
But because of that, they're having cases coming back now.
That's wild.
yeah.
You
Because
said
somebody who was 5 years at that time will now be what? Calculated 7, 8.
Huh?
No, after
So
us
4 years,
sitting
like if you
at home.
calculate from like COVID to now, when we stopped, like the vaccinations sort of went into a bit of the gaps in there. And at that time, we know sometimes it's because the vaccine's not available, and sometimes to the way of transport, we use the cold chain system to transport vaccines. It needs to be frozen. Like those boxes they see holding. They are cold chains. So if the vaccine gets exposed, that's it denatures. It's not more effective.
So the advice is those kids that didn't get vaccinated have to.
Parents and we have also the religious aspect of it. And then we have the what's that word? What's that word for people who have theories about everything?
Oh, the conspiracy.
Conspiracy theories about vaccines being work of the devil and vaccines. They put chips in there that the chips they to tracking you. There's so many, and it's caused people like fear mongering. Has caused people not to get vaccinated, which has put all of us at risk.
Oh,
okay. Doc, I move away from conspiracy theory to what forms on your skin when you get measles, and what does it develop to?
So we are talking about. You see that before you get to the part where the red rashes are starting, then the severity is going really getting really bad.
Oh,
so visually
wow.
that's the
that's the highest point. That's what you're getting to, because the cough, 2 to 3 days cough should be the start. And the funny thing about 2 to 3 day cough, remember we talked about TB having the same thing. So every respiratory condition that starts with a cough, and the cough is like prolonged, that's a problem. You should know that something is really going wrong. Yes,
something the body is rejecting.
Exactly. And the worst part is that the more the person's cough, it stays so close here that when the more you cough, the more you're spreading to other people. But because you have vaccine, maybe you are cool. You just walk through the room and you're good, right? But somebody else who is not protected, maybe for some reason the person grew up in a village where maybe vaccination never got there, but the person is fine walking around, right? The person contracts it and it's severe for the person, or somebody who's immunocompromised, like HIV, like any condition that's caused the person's immune system to be shot. It means that being exposed to measles will make the person likely end up in death.
Wow.
So it's important that we all get vaccine, because there's 2 shots that's supposed to be given. You're supposed to be given one when you are 9 months and then one when you're 18 months old.
Okay, yeah.
It's part of the EPIs, the expanded program for immunization that the WHO has brought about. So right now we have vitamin A on that list too.
Vitamin A?
Yeah. We've added vitamin A to the list. We've also
added... what you are injected with vitamin A?
Yes, we are. Yeah.
But people are not getting enough.
Exactly.
Why? Nutritionally,
yes. So we are subsidizing. We are bringing a lot. We are trying to help as much as the child develop. And then we've also added this to it, malaria now. Malaria vaccine is now part of it.
So now there are 9 child dragon killer
CKD
diseases.
So when you look,
gave you a shortcut. CKD.
Okay, so what are we looking at on the screen now?
So now we have vaccine-preventable disease, as you asking. So these are them. Because of vaccine development, all these are being handled. There's one that is not there. Yeah, so HPV is there, cervical cancer. We have cervical cancer added to the list.
Pneumococcal, diphtheria, tetanus, pertussis,
also
pertussis.
whooping cough, which is also whooping cough.
Yes, poliomyelitis, hemophilus, influenza, that's type B.
Right.
Yeah. Measles is down there. Mumps, yeah. Rubella, that sounds like a very, like some chocolate this thing. Rubella. Then varicella. Like a Coachella, rotavirus, hepatitis B, hepatitis
now in
A.
cashew flavor, rubella.
Then HPV is there. Meningococcal. Yeah, meningococcal.
Yeah,
you know
so
meningococcal?
That's where you get meningitis. Cerebral meningitis.
So a human being gets all these vaccines.
Yes, we are exposed to
So
this.
this is
Not
like,
part of the world.
is this like the inside of a cell or is just a diagram?
No, there's just a diagram exposed so it's using a cellular structure and the way the COVID structure had this.
The germ, the cells.
Yeah, the cells points.
I was looking for the beauty.
Yeah, so you know the meningococcal, right? The northern part, you have a meningitis belt at the northern part. So when you come with neck stiffness and other conditions, and we ask that, have you been to a north, blah, blah, certain part of the way, that's where it starts with meningitis.
Is that different from cerebral spinal meningitis?
So the meningitis family.
The group.
Yeah, the group. So we have the northern part of the country.
So
There's a belt that runs across Africa.
Yes.
Around the world. There's a
so
belt.
naturally, a human being should have all these vaccines.
Vaccines, yeah.
Like every
and
single
even the
one
most
of them.
important one for adults right there, those who are sexually active, is the HPV one.
Those are
So women, sexually active or non-sexually active, you should get the HPV vaccine if you're a lady.
If you're a lady.
Yeah, because you are pre-exposed to it helps prevent cervical cancer, vaginal cancers.
Okay.
Right, but most people are not. You ask most people, they don't even know HPV vaccine exists.
With technological advancements, do you see any other preventable, vaccines being developed? I mean, because with time, all these have come along, right? In an ideal world,
the one we are waiting for right now is common cold. What? A vaccine for common cold.
Right.
The
Yeah,
influenza
so
virus,
I
like
think that would be great. So it prevents it.
it prevents totally.
completely.
Yeah.
Forever.
Common cold
Yeah.
is one of them because it's seasonal. Every time the weather changes, you see people
To
reacting.
any extent, can this be too much on the human body? Because it looks like a lot. Like just looking at it and having all these vaccines in you.
And the funny thing is that naturally your body has bacteria that helps it already.
Okay.
Like it has in your digestive system, your vagina orifice. There's bacteria that are normal flora to these places. That's supposed to help with the pH and everything, help with digestion. That's normal. Even your mouth. So we say the dirtiest place is your mouth actually. Because it contains most of the germs, yes, actually. Most germs are found in your mouth.
And we kiss like that,
Exactly.
Wow.
So you transfer it so
See,
easily.
you and who now? What's it we?
So
Wow.
as I said, all
But
these
interesting,
things.
Doc, when you just said, when we walk through town and I always come back, like I always feel like only God knows what I have inhaled and
ingested and
ingested in my mouth, and so I start getting all things in
but
my mind, and I go
yeah.
and wash my mouth, and I want to wash my face.
So that's why I don't get why people
Shower.
come from town and don't want to shower.
Because it's
Yeah.
very, very important to change
It
your
doesn't
clothes.
make sense.
Yeah, because you've grabbed a lot of things.
So some people have this laundry basket at their door.
As soon as they get to
Yeah,
the
they
door,
have like they
just
take
drop
off like
it.
most of the external
Doc,
stuff first.
even Jason, he lives far. When he gets,
But I think he sits in his own car, so I think I think it's more in
he
a
has to
bubble.
remove his clothes when he
Again, like then you need to give him overall.
yeah, he has-
Hazmat. He needs hazmat.
Hazmat suit, yeah.
Hazmat
Hazmat
suit.
we have
PP.
to go. Yeah. So
PP.
just when you arrive at work, you remove
Yes,
all your
yes.
clothes. When you are going, you can then we find some
No,
wash.
but our
for you.
advocacy for this is for the mothers and the fathers who have kids who have not been immunized or vaccinated. Please get it done. The book that we give you at
Yeah.
antenatal is in there. It shows you when the date is and everything. Please show up.
Show up.
These things are free. Just show up and get it done.
Doc, thank
So,
you.
okay.
I have to leave us here,
Yeah,
unfortunately. Time is up. But thank you so much, Doc. Guys, when you're coming to work and you get to here, know that you've come from home through town and everything. Remove your clothes.